These are the real stories of the patients, medical, and support teams of St. Joseph Mercy Health System, whose lives intersect for a brief moment in time to achieve remarkable outcomes.
We bring hope, we bring love, we bring our strength, and all we're made of, you and I, together.
I'm Lila Lazarus. You want to go out for a night on the town, but you're morbidly obese. You can't fit into your dress clothes. Your dress clothes? You can't fit into the seat. It's not big enough. You're convinced no one wants to sit next to you. It feels like everyone's staring at you. It's a horrible feeling. But worse than the discomfort, being that obese is deadly. A 2-hour operation can change all that. What you're about to see is truly remarkable. They're people who've tried every diet known to man. Despite their best intentions, they haven't been able to make diet and exercise work.
Food was my comfort. Food was everything.
They could be anyone you know. Your neighbor, your coworker, your sister, you.
I think I was in denial. It wasn't until I looked at myself in a photo and it was like, wow, look at that. And it's disgusting.
Never once in my adult life have I been thin.
I got lazy, I quit exercising, and my weight actually shot up at 335 pounds.
Looking at him here, it's hard to believe that Landis Lawton once fit into a U.S. Marine uniform.
A Marine is a Marine and always is a Marine. When I gained all the weight, I couldn't get in my dress clothes. That hurt me.
Teresa, his wife, is also morbidly obese.
You realize that you've run out of sizes and you don't know where to go. Every pregnancy I would put on a little bit more weight, and then eventually I was just the roly-poly, mama's gotta have cushion for the babies to live on.
Kelly Brighton is a mother of 3 and a middle school teacher.
Does anybody have any questions about their grades? Did anybody look at them?
Look at the ball, look at the ball, look at the ball, swing. Oh, set it up.
She and her husband Scott are volunteer coaches for their daughter's t-ball team. Kelly does most of her coaching from a lawn chair.
The greatest husband, beautiful kids, I have a great job, everything in my life is great. The only thing that I want to change is my weight, because I do not feel confident in the way that I look. And I don't want to be the big person of the group anymore. I mean, at work, I'm the biggest teacher. With my family, I was always the fat sister, and you want, your younger sister to look up to you. And, I felt embarrassed for her. I felt bad that I was, so overweight when I had this gorgeous younger sister, and I always felt embarrassed that she had to tell people I was her sister with the way I looked.
It's stories like these they hear every day at the Michigan Bariatric Institute, where Dr. Talal Zeni is the medical director.
So how are you feeling today?
I'm excited.
Excited? Okay, great, great.
The patients who come here have decided enough is enough.
If a patient gets to be to where they're morbidly obese, really surgery is the only way to lose the weight and maintain it off.
This institute was named a Center of Excellence by the American Society for Bariatric Surgery, and Dr. Zeni is fellowship trained in bariatrics. And Kelly's made her decision. She tells her family she wants bariatric surgery.
They didn't think I had to do something this drastic. Even my husband at first was like, no, 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 and then he goes, give me 6 months.
We hit it real hard for 6 months, and I lost 90 pounds initially, and Kelly lost 11. And that really wasn't hard, wasn't good on her.
This is what's right for me. There was nothing else that worked. This is permanent, and it's something that makes me change my lifestyle.
People might lose some weight over 6 months, but then unfortunately can regain it back. Surgery allows people to maintain that weight loss over the long term. I have countless patients who have lost 100 pounds, for instance, multiple times before the surgery, unable to keep that weight off. And that's just the rule rather than the exception. A lot of people feel that before the surgery that they're helpless, and so sometimes they don't even believe that surgery can work.
Nothing else has worked. Nothing else, diets, exercise, nothing else. I mean, medication, nothing has worked. I mean, part of me still thinks maybe this isn't going to work. I know that it has to. I know in my mind it has to, but part of me still thinks that this isn't going to work.
But bariatric surgery does work. Remember the Marine Landis Lawton and his wife Teresa? my gosh. You fill the page.
Have you tried to lose weight without success? Join Lila Lazarus now for a live web chat about bariatric surgery with Dr. Zenny and patient Kelly Brighton from tonight's program. Join the conversation and get your questions answered.
Can do incredible things. Now they can even help save a life with hands-only CPR. If you see an adult suddenly collapse, just call 911, then push hard and fast in the center of the chest until help arrives. Learn more at handsonlycpr.org.
Gaining weight was easy. All I had to do was sit down and eat. Losing weight's a lot harder. I have to work at it every day. But with every step, I lower my risk for type 2 diabetes and heart disease. And that makes every step, every choice, every day very much worth the effort.
Learn how you can help stop diabetes by losing weight, eating healthy, and staying active. Visit checkupamerica.org or call 1-800-DIABETES.
Have you tried to lose weight without success? Join Lila Lazarus now for a live web chat about bariatric surgery with Dr. Zenny and patient Kelly Brighton from tonight's program. Join the conversation and get your questions answered.
You could say it was a big wedding.
Mm-hmm. We're just having fun. We're just having fun. You know, the big, beautiful, love me as I am kind of people.
We didn't care what anybody else said or what anybody else thought. We liked each other. We had each other. And that's all that it mattered.
But that wasn't all that mattered. Bigger sizes come with bigger health problems.
My life was pretty much headed downhill, and I didn't care. I was taking right at 17 pills a day to keep my medical problems in line.
I went to go see the cardiologist, and he told me, if you don't do something, you will have a massive heart attack by the time you're 40. And it could kill you. My cholesterol had gone up, and I was borderline diabetic. I had 3 blood pressure medications to go through every day in order for me not to pass out. I felt like I was drugged. Literally, I didn't feel like myself. I felt like I had to pay attention to every heartbeat because I was having palpitations. My whole universe started to revolve around my heart. And you don't want to do that when you're 33, 34. That's just not what it's about. You know, you're supposed to be happy and living life the way that it should be lived, not taking your blood pressure 3 times a day.
And then, a blunt comment from an old friend.
She looked at me and she said, "You were always the tiny one. What happened?" And I just kind of looked at her and I said, "Well, life happens." She said, "Life doesn't have to happen like that. Let me tell you about something."
But like Kelly, Teresa's husband didn't want her to have surgery.
He got really, really angry because I had decided to make this decision. And he and I got into a really big blowout. I mean, just yelling, stomping out of the room, slamming doors. And we finally went to bed.
And I woke up about 1:30 in the morning, got on the computer, did the research and all that. And then when I saw how beneficial it was, that's when I reversed my thinking.
I woke up to a stack of papers, probably about 1.5 inches, 2 inches thick, of all of the different bariatric surgeries with a sticky note on top that said, "Babe, I think we need to do this together."
Last year, Dr. Zenny performed gastric bypass surgery on the Lawtons a month apart. Through tiny incisions, Zenny creates a small pouch out of the stomach. Patients will lose 70% of their excess body weight. How would you describe this surgery?
Life-changing. Hard. Hard. It's not an easy thing. It's not an easy thing at all.
It's not the easy way out. I think that people really have to have a lot of dedication in terms of eating right, getting their protein in, for instance, exercising.
Come on back.
This isn't just surgery. The Michigan Bariatric Institute offers the Lawtons a team of experts who guide them on cooking, exercising, and shopping. And the surgery will cure diabetes in 84% of patients. It helps resolve sleep apnea, high blood pressure, reflux, and joint disease. The list goes on.
My daughter made it all worth it when she came up to me one day and gave me a hug and she said, "Mama, I can hug all of you all at once. And she just got the biggest smile on her face. I said, well, thank you, baby. And that made it all worth it.
They've done unbelievably awesome, both of them. They've both gotten down to their ideal body weight. They've both gotten rid of a lot of medical problems.
You can get rid of 15 of the 17 pills you had to take every day to be healthy.
Teresa, she had the reflux, that's gone. Landis, he had diabetes. He was on pills for that, off of those. He had a CPAP machine, off of that. Arthritis, other medical problems. Really, it's a whole new life for him, and both of them.
Get rid of the hypertension, get rid of your cholesterol, get rid of the borderline heart disease, and be there for a woman that is there to support you through anything in life.
And now, Kelly's husband is ready to support her.
It's a pretty serious surgery. Are you afraid?
I am afraid. There's a lot of things that go into play, but I trust that it'll be okay.
Kelly has agreed to let us follow her every step of the way.
And when people think of Kelly, what do you want them to think when this is all over?
I don't know. I think kind of like where everything matches, because I think I have a, happy, bubbly personality, and I'm good at what I do, and I throw my heart into what I do, and she's got such a pretty face, and I would just like to be like she's the good person all around her. I'm not saying this right, but I just want my insides to match my outsides.
You know you're a good person all around, but you don't want to be all around.
Right. Good person up and down, not all around would be great.
And what about standing next to your sister?
It'll be cool. To be thinner and to feel confident, like, okay, I deserve to stand next to her. 'Cause silly. And she just had a baby, and he's the most beautiful thing, and to feel confident that I have this gorgeous sister, and my parents are wonderful and have never made me feel less, but to feel proud of the way I look, and that it matches how my sister looks, kind of thing. That would be cool.
For extra motivation, Kelly agrees to document the process on a home video camera.
I'm excited. This whole TV portion added to my surgery, actually, I think has helped me not be so stressed out and nervous. In about 2 hours and 45 minutes, I'll be having my surgery, and the next time you see me, not that I look fantastic now, but I will really not be looking or feeling so good.
Hello. How's it going?
Good.
How are you doing?
Good.
Hey, Kelly. How's it going?
I'm okay. I'm ready.
You're all set?
Yeah.
There's 3 different types of surgeries you could have done, right?
Yes. The gastric bypass, the sleeve gastrectomy, and the lap band.
Why is she a good candidate for the sleeve?
I think she's going to have really good weight loss with the sleeve gastrectomy, and there will be kind of minimal downsides with the sleeve for her. We try to individualize surgery for each patient to achieve the best outcomes, really. So we're going to do a laparoscopic sleeve gastrectomy.
Dr. Zenny was one of the first surgeons in Michigan to perform sleeve gastrectomy. Through tiny incisions, he removes more than 3/4 of Kelly's stomach.
So this is a stapler, and basically what it does is it lays down 6 rows of staples and divides in between. So it leaves 3 rows of staples on each side. This is all teamwork, We have a great team of people here. In about 40 minutes, 85% of her stomach's gone. I mean, we couldn't do that without the technology that we have now.
And a bonus, Dr. Zenny finds a hernia and makes a quick repair.
Happy with how it went?
Yeah, everything went great. Hello, Scott. How's it going?
Oh, real good.
Everything went great. Now, she did have a hernia there, probably related to her old gallbladder surgery.
Oh, okay.
Or at her belly button. And so I put stitches to fix that, too.
On her second day post-surgery,
I do feel pretty good. I'm getting up walking, and yeah, so I'm excited.
And once Kelly leaves the hospital, that's when the real work begins. Kelly chronicles the ups and downs as her weight begins to fall off.
As of today, I'm down to 264, and before I started any of my pre-op diet stuff, I was at 280.5, so that's like a 16-pound loss, so that's not bad for 2 weeks. Nobody's cleaning up, nobody will listen, just all of the stuff you deal with as a mom, but then on top of that, I feel like crap. If you look, you can tell I've lost weight. That's exciting. Here I am, and here's my dress. I'm very excited because it's a size 20 and I haven't worn that since college. I just can't believe it. I can't believe I've lost 50 pounds. I can't believe it. I mean, I know it, and thank God, because I was stuck at my, 40 pounds. 50 more pounds and I would be at goal.
Kelly credits much of her success to the comprehensive, compassionate support she gets from the Michigan Bariatric Institute.
Not just saying this, but I do think the Michigan Bariatric Institute is the place to do it at because of their support that they have before the surgery, totally during the surgery, and then afterwards. I called, a whole bunch this week about a bunch of little things, and never do they make me feel like it's a stupid question or I'm just being silly calling.
The staff pride themselves on caring for patients long after the incisions have healed.
We like to get together every year with our patients and either do softball or bike riding, or sometimes we just do a picnic. But it's a good chance for us to get together in a non-formal setting and really have a good time together.
Hi, I'm Terry Aldini, and I had my surgery with Dr. Zenny December 28th of 2009, and I've lost about 153 pounds.
Over and over, patients say they never thought they'd look or feel this good.
I just had surgery August 17th with Dr. Zenny at the Roux-en-Y, and I've lost 40 pounds already.
And Dr. Zenny did my sleeve December of 2008, and I lost 135 pounds from my heaviest weight.
Dr. Zenny was my doctor. I had surgery August 25th, 2010. I have lost 78 pounds.
I've lost 77 pounds. Unbelievable. My measurements keep going down. I can't put it into words how happy I am that I had this surgery.
Now Kelly, who remember, sat on the sidelines and only had dreams of one day running a race.
I would like to do like a 5K.
How about a half marathon?
All right, well, we'll start with the 5K and we'll work up to a half marathon. But that would be something I've always wished I was able to, get out there and run.
But even Kelly can't believe what she accomplishes less than 6 months after surgery.
You did.
Have you tried to lose weight without success? Join Lila Lazarus now for a live web chat about bariatric surgery with Dr. Zenny and patient Kelly Brighton from tonight's program. Join the conversation and get your questions answered.
What's it feel like when a woman's having a heart attack? Chest pain, like there's a ton of weight on your chest. Severe shortness of breath. Unexplained nausea. Cold sweats. There's an unusual tiredness and fatigue. There's unfamiliar dizziness or lightheadedness. Unusual pain in your back, neck, jaw, one or both arms, even your upper stomach are signs you're having a heart attack. Don't make excuses. Make the call to 911 immediately. Learn more at womenshealth.gov/heartattack.
I want to thank everyone for making this day so special. Dad, you've been my inspiration. I love you.
I love you too.
And Mom, I miss you so much.
Type 2 diabetes steals the lives we cherish most, but it can be prevented. Know your risk before it's too late. Stop diabetes. Learn how at checkupamerica.org or talk to your doctor.
Have you tried to lose weight without success? Join Lila Lazarus now for a live web chat about bariatric surgery with Dr. Zenny and patient Kelly Brighton from tonight's program. Join the conversation and get your questions answered.
Okay, here we go. Everybody kind of look right up here. Nice smiles. Aw, very cute.
It's now 4 months. Kelly Brighton has lost 82 pounds.
It's a whole new you.
Thank you.
How do you feel?
Wonderful. Very different. I feel so much, it's funny, so much more myself and so different. I have more confidence and then I'm more self-conscious all at the same time. It's unbelievable. I can't believe that this is me.
New routines? What's been the impact on the family?
Very much. Well, our house has changed, which is one thing. We had our living room upstairs, and that's where we ate. We didn't have a dining room. And then we made our old living room our dining room. So we actually eat at the table as a family. And I didn't really put it together, but that was why. I mean, we want to eat healthier. You can't eat healthier sitting in front of the TV, you know, shoveling food. And so eating as a family is real nice.
And Kelly, she's decided to do her first 5K. Meeting this former couch potato has agreed to run a 3-mile race.
Wanted to share, here it goes, that there is my turkey trot runner shirt thing. First of all, the fact that an extra large fits me, awesome. Also, we just got done running a mile. I never in my life thought that that would even be a possibility. I feel like I want to pass out just a little bit. Need to drink a little bit more water. But we've been training now for a couple weeks, probably not as often as we should. But we're gonna do it. A week from tomorrow will be the trot. I'm gonna apologize in advance for the heavy breathing and sweating that you will be seeing on the video then.
The women's race, third place, went to Tammy Gold from Clarkson, 1916.
I can't believe I did it.
You never stopped once.
You
did.
I can't believe I did it. I did it. I ran a 5K. I didn't think it was possible. Thanks to Stu.
Hi.
There you go. Now you're not blurry. We did it. I didn't stop one time. My knee hurt a little bit. It's good.
Landis Lawton, who lost a total of 150 pounds, is getting ready for a military ball. The only question, will he fit into his Marine uniform?
The pride just bubbled out. It was like October in '82, becoming a Marine for the first time again. In my heart, I was a Marine, but when I put that uniform on again, I am a Marine. That's why in my front yard, I fly the Marine Corps flag every day. God bless it.
Now you look like a Marine again.
Yeah, with sirs and all, right?
And life moves on.
We're really excited to go to the Fox Theater as a family. You excited?
Yeah.
Excited?
I'm ready. Yeah.
Yeah, how about you, Dad?
Sure.
Yeah, I'm very excited. A fun family day out. Yeah, we're very excited to go. Getting ready was fun. Getting dressed these days is a lot more fun than it used to be because I'm happy, you hear this, with the outcome, how I look when I'm done. And I'm very excited because I can cross my legs at the show, which seems really silly, but I can cross my legs so much better now. Do you hear her? I can cross my legs so much better now, which makes, you know, watching and enjoying and everything a lot more fun. So, yeah, we'll check in a little bit.
Kelly, the former size 28, fits into new clothes and a seat at the Fox Theater for a holiday show.
What'd you girls think?
It was awesome. It's awesome.
Some of the perks of being smaller, I could sit in the seat comfortably. There was lots of extra room on the sides. It was really, really enjoyable. I didn't feel like I had to go to the bathroom the whole time because I was leaning on my stomach, and it was it was a really, really good show. I have lost officially, as of this morning, 91 pounds. That is amazing to me. At 5 months, I've lost 91 pounds. That is like 2 of my children. And looking back, I didn't know I was that big. I started at a 28, which, you know, is like the very, very high end of the big girl store. And right now I'm in a 16, so I'm like the small sizes at a big girl store, or I just wear the bigger sizes at a normal store. It's just amazing how much better I feel day to day. I know, I get all teary-eyed, I know that I have added years to my life because of this. I know that I had more time with my kids because I did this. Michigan Bariatric Institute, thank you from the bottom of my heart, which, you know, isn't surrounded by all kinds of fat like it used to be. Thank you for all of your support and help. Thank you, thank you, thank you.
It's a whole new Kelly. You can follow Kelly's progress step by step. We've created a website, stjoeskellycam.org. The health benefits of this surgery are so tremendous, most insurance companies will cover the operation. To find out more about the Michigan Bariatric Institute, go to stjoeshealth.org or call 1-877-WHY-WAIT. That's Discover Remarkable. Thanks for watching. I'm Lila Lazarus. I'll see you next time.